Colorectal cancer, which starts as an abnormal growth in the large intestines, is the fourth most commonly diagnosed cancer in Canada. A quick glance at the data is promising. The overall incidence of colorectal cancer has been declining since the 1980s. But look a little deeper, and we start to uncover the emergence of a health crisis. While overall incidence is decreasing, the incidence of colorectal cancer has nearly doubled amongst Canadians and Americans under 50 years old. The etiology behind the rapidly rising rates of the disease in younger adults is currently unknown to the hundreds of researchers investigating this. But what is certain is that colorectal cancer remains undetected in many adults under 50, often not being diagnosed until it has progressed to an aggressive form that may not be treatable. Researchers are rightfully urging people not to panic, as age is still the biggest risk factor for the development of colorectal cancer. However, this may be the very reason why colorectal cancer frequently goes undetected in younger adults. Physicians tend to see this as something that really only affects the elderly, so they tend to recognize symptoms and act on them later in younger patients. A study revealed that American adults under 50 have to wait on average about 2 months longer to receive medical attention after detecting symptoms compared to those over 50. Canada's highly successful colorectal cancer screening program is credited for lowering colorectal cancer rates in patients over 50. In Ontario, individuals at an average risk for developing colon cancer, those above 50, are recommended to get screened every 2 years using an at-home fecal immunochemical test. Those with a parent, sibling, or child with colorectal cancer should be screened with a colonoscopy as they are at higher risk, which is a more comprehensive test than a fecal immunochemical test, every 5 to 10 years. Physicians are encouraging patients to look out for early symptoms, the most common of which are rectal bleeding, changes in bowel movements, abdominal pain, and unusual tiredness. While it can be scary to think that some risk factors for colorectal cancer are out of our control, like age and family history, as young people, there are certain choices we can make to decrease our risk of developing colorectal cancer. Some of these include not smoking and lowering alcohol consumption, engaging in regular physical activity, and eating a diet high in fiber and low in fats. All this to say, while these trends are certainly concerning, by staying informed and proactive about our health, we can work towards combating the rise of colorectal cancer rates amongst the younger population.